Good morning, everyone. I'm Professor Zheng Wang, the Associate Vice President of Strategic Research. It is with great pleasure that I introduce Professor Sheldon Schuster on behalf of our Vice President of Research, Professor Ho Chen Anderson Shang. Professor Schuster is a distinguished figure in the field of biotechnology. His career commenced at the University of Nebraska in 1990, following which he assumed leadership at the Interdisciplinary Center for Biotechnology Research at the University of Florida. Notably, he played a pivotal role in establishing the Sid Martin Biotechnology Incubator, a pioneering initiative among university biotechnology incubators in the United States. In 2003, Professor Schuster took on the role of president at the Keck Graduate Institute for Applied Life Science in Claremont, California. During his tenure, he collaborated closely with the biotechnology industry to develop graduate degree programs that bridge the realms of science and industry alongside a diverse array of healthcare professional programs. Among his accomplishments are the establishment of the Masters in Business and Science degree program, a leading graduate program that integrates business and science. Additionally, he spearheaded master's program in biopharmaceutical bioprocess engineering, regulatory affairs and clinical trials, as well as in medical devices and diagnostics. Furthermore, he founded a school of pharmacy and introduced programs in genetic counseling, genome data analytics, community health administration, physician associate programs, and a doctorate in occupational therapy. Professor Schuster also initiated international online education initiatives in India and Malaysia. Having served as president for 21 years, Professor Schuster has recently transitioned into new roles focusing on teaching, continuing to inspire and educate future generations in the field of biotechnology. Please join me in welcoming Professor Schuster to give his distinguished lecture.
Good morning, and thank you for that very kind introduction. I want to, for those of you who are looking at that picture and looking at me, I want you to know that picture was taken when I was in high school. But it actually, it's a good way, I think, to introduce what I would like to talk about today. And again, thank you for that broad introduction. It's a real pleasure to be here with you at Hong Kong and especially at City University. And there's lots of reasons for that. But I want to just say one thing, that I haven't heard the term emeritus used much in China. And what that means is I retired in July after being the president for 21 years. But I stay on as a faculty member and hopefully we'll be able to use the experience that we've had to help other folks do some of the kinds of things we do, but also to learn from each other. I can assure you I'm going to talk today about the program that we set up, and I'm open to talking with anybody. I look forward to talking with folks about what we have done and what we might be able to do in terms of helping young people get into the innovation world with all the incredible technology that's occurring. But also, we're here to learn. And I will tell you a lot about what we've done, how we've succeeded, but I certainly don't have the time to tell you all the mistakes we've made. We don't have time in seminars to do that, but I think we can all learn from each other, and I look forward to being able to do that. But I want to talk about kind of a personal journey, if you will, over what sort of happened and why I got into this. And you won't find any of it surprising. But let me just tell you that the Keck Graduate Institute of Applied Life Sciences is a very new institution in the United States. It's a member of the Claremont colleges. You may not know of that consortium of 7 schools. You probably have heard about Harvey Mudd College or Pomona College or Claremont McKenna College. those are our sister institutions. There's 7 of us. And we form institutions over time, actually starting in the late 1800s, with the purpose of filling a societal need. When there's a new need, when there's something needs to be done, we form a school to meet that need. And they're independent schools, but they focus on that need. And we were formed in 1997 because at that time, I know some of you, look here, some of you weren't born in 1997, but I can assure you that 1997 was the same year that Google got its domain name. Okay, so I guess nothing much changed in the last 27 years. And remember that this was before the first human genome was sequenced. And I remember I was working on a piece of that project and realizing that that was a $3 billion project. And now not I, but people who know what they're doing can sequence our genome for less than $100. So the technology has been explosive. And the reason we were formed, because it was clear to our founders that the life sciences were going to be the science of the 21st century. And there was no institution in the United States that focused on building that bridge between the business and science in the life sciences. So we were formed. We were the newest member of the colleges. We began our first students in 2000 with 20 students. I'll tell you a little bit about our growth and what we've done since then. And I became president in 2003 when we were a very, very young institution just beginning. But I want to talk to you about how I want to, let me go back, there we go. I want to just tell you a little bit about my experience and what I saw as the gap and the need in that area of bridging science and business. And then the opportunity of using an educational tool to help solve that problem. And the program we put together, the Master of Business and Science, and it's an experimental program. I'll tell you a little bit in depth about how that program works and the philosophy behind it, which is the most important part, actually. And then the question is, was it successful? Did the program work? And I'll tell you a little bit about that. The other thing is, I think there's a bridge, a very strong bridge, between programs like this and how to bring science and technology further along the development pathway. The students working in this area bring one thing that's really, they'll actually bring 2 things that's really incredible, and I want to emphasize it. They bring naivete and energy, because the way that these companies need to move forward is you have to have people who have confidence and faith and energy, but you also have to have the knowledge and the discipline and the work ethic to really dig in to find out what's happening in those. And then I want to talk about sort of what opportunities we see. And I am now a 3-week expert in technology in China. And so you'll get my naive and pretty much uneducated predictions and saying about how we might work together. So let's just begin by saying, so what was my experience, and where does it sort of come from, and how does it inform what we were doing at KGI? So I personally started several biotechnology companies, and I can say proudly they failed. But I can also say proudly that we learned a great deal from it. But more importantly, probably not just my own personal experience, I spent 15 years at the University of Florida initiating and leading one of the first biotechnology incubators in the United States. And I really had a first-hand view of technology transfer from one perspective, certainly, and seeing what worked and what didn't work. And I saw some successes. I saw some of these companies do really quite well. Some of them have been taken over and they're still ongoing and really doing good things. Most of those successes, by the way, have been bought by other companies. And so all of their founders now are all working very hard on being good golfers. But they've been very successful and the technologies are moving along. But mostly what I saw was failure. And I don't mean to drop my voice when I say failure. They failed. They failed honestly. They didn't cheat. They didn't steal. But they certainly learned something from it. But the point is they failed. And why did that happen? Well, we gave some thought. We actually were a bunch of us who were working on this and thinking about it, saying, well, what's the difference? What distinguished the ones that failed and those that succeeded? And it was clear to me in the life sciences industry, it was never a technology failure. Okay, that's a pretty strong statement, but I can tell you that the technologies pretty much work, especially if you're smart enough to know how to change them and move them and fix them and adapt them to what needs to be done. always a failure of management. Without exception, had they had better management, the companies would have succeeded. And the thing we wanted to look at is, well, what was it about those managers that failed? What was the difference between the managers that were successful and those that failed? Well, there's two kinds of managers that we saw, especially coming in the incubator. We saw sort of two buckets of kind of managers. The first one were the business people. The people who come from a business background. And they did not have science and engineering backgrounds. So when I say science, by the way, I'm always going to say science and engineering. I just get, that's the term that I try to use. They couldn't make technology decisions. When they were faced with making a technological decision, they wavered. They kept asking for more data because they really didn't understand what was sufficient information to make a decision. And the most important decisions they had to make were how to pivot the technology, how to take what they had, how to see where it was going, and say, okay, can we do that with it? Or can we move it? Or can we change it? Or can we adapt another technology to fit with it? They were what I call generalists. They came from other industries, mostly finance, by the way, which in my experience may be unique. But I can say they came with a generalist background. Now, in one of the companies that I began, we had a CEO who came from, his experience was collecting garbage in New York City. And that didn't show much relevance to the life science industry, and we paid the price. He really didn't understand the life science industry. And I can tell you actually how he sort of misled it, and well, if we have time to talk about it. Then there's the other bucket, the other kind of leaders in the companies that I saw. And these were the scientists, guys like, myself, many faculty, and I hesitate to use the term typical faculty, but faculty who care about their research. I mean, I'm using the great big giant we faculty kind of thing. Globally, we care about our science. We want our science to be better. We want to get it published in Cell and Nature and, pick the journals. That's what our focus is, and that's what it should be. That's what we get paid to do, for heaven's sake. So we focus too much, I think, on the basic research. And we want to perfect it. We want to get it better. We want it to go further. We want it to be publishable. Make sure it's really saying what it does. And instead of not being able to make a technological decision that's rational about how to pivot something, we don't want to pivot. We know we're in love with our technology. And again, that's a broad statement. So forgive me for generalizing, but that's really pretty much what I want. And we were unwilling to give up control. This is really, I found it fascinating that scientists were extraordinarily hesitant to have someone invest in their company and dilute their ownership because they wouldn't control it. And we used to have to do sort of exercises with some of these entrepreneurs, because the question they had was, well, if someone's going to put in, so if you own, would you rather own a whole grape or half of a watermelon? It was that kind of a metaphor that we had to work with. So if somebody puts money in the whole thing grows, and you only own half of it, but it's a lot big. I mean, I don't have to overdo that, but you get it. You get it. And clearly, just pretty much like these folks didn't, they don't appreciate the incredible issues in the life science industry. And one of the things that is so important is two things must happen, or well, I'll make it three. There are two parts of the life science industry that are completely, I wouldn't say unique, but crucial to identify as differences. One of them is they have to be tested in human beings. No matter what it is, it has to be safe and effective, especially if it's a therapeutic, okay? If it's, there are various bars for different kinds of things you're doing, but at the end of the day, it has to be safe and effective, and testing that in human beings is extraordinarily difficult because I don't need to tell you, humans are really bad experimental animals. They're very hard to work with. It's really hard to tell people exactly what to eat, exactly what activities to have. We all know that I'm being slightly facetious, but it's really hard to do good clinical trials. They're very, very hard. The other thing is regulation. Everything about our industry is regulated. There is a government agency, probably many, many government agencies, that must approve everything you do, and it's different in every country. So it's extraordinarily complex. You can't sell drugs in Japan if you don't do the clinical trials on Japanese. Okay? And I think it's the same in China, but I may be wrong. That was my impression. I mean, look, we're not that genetically different, so it's kind of silly. These are obviously trade barriers, but it doesn't matter. They're barriers. You can't be in business unless you do it. You have to understand those kind of things. The other thing is production. You have to make the stuff. And you have to make it to an extraordinarily high level of accuracy and purity. It must be and we're talking about protein molecules very often in the life sciences. So you can't just certify the production method. You have to certify every batch that's made. It has to be identical. It has to be safe. It has to be the same for every single dose. Anyway, so there's lots of things like that the basic scientists don't really get into, nor should they. Okay, so what do we need? And remember, I'm an educator, so you might guess what we need. We need life sciences leaders with engineering degrees, engineering and science background, and you might guess what that might be, an understanding of the industry. These are fairly straightforward as we discuss it. They have to understand the industry, and I will say they have to have at least one area of focus within those topics I talked about. Is it production? Is it clinical trials? Is it regulatory affairs? Is it marketing? Do they really understand the markets? Things like that. They have to know one area at least. And boy, they have to have experience. And I will say, experience, succeeding or failing, and I suspect failing is more instructive than succeeding. Because often you succeed because you're lucky. You happen to be at the right place at the right time, and somebody came and bought your company before they found out the technology wouldn't work. That's a little bit facetious, but only a little. So I think success is often lucky, and that's overstated, of course. So some people are just really, really good and get it right. But you need experience, and no matter where that came from, it's good. So what do? Well, what would I do as an educator, right? My view is, we can solve all of our problems in the world by education. But let's talk about how we wanted to educate, the educational innovation kind of happen. And that, I had that opportunity in 2003, moving to Keck Graduate Institute from the University of Florida. We had 40 students and 20 whole alumni. But what that did is it was extraordinarily early in the institution. We could change it, we could build it, we could use it as an almost clean slate about how to do these kinds of things. And the board gave me a very, very clear goal. Can we build a professional science and business degree program that will actually lead to becoming known as the educator of the next generation of life sciences leaders? Now that's a pretty lofty goal, but it was kind of fun, and I wasn't smart enough to say that might not be possible. So we took on that task, and it's been really fun. But I want to say a little bit like, so hold on. So at the time, I had been doing education for a long time, and I've had lots of experience, and that's another way of saying I'm old. And what I was able to discern really is most graduate education fits into one of these two things. Most graduate programs are focused on research. Now, I'm not here to tell you there's anything wrong with research. I loved research. I did it for many, many years. It's really exciting, and it's really crucial. It has to be done. We can't do less of it. We really must do more of it. But we got to think in terms of what the students can do as well. As an academic, I had, I think, like 60 PhDs graduate from my laboratory over time. Well, and that's not a particularly giant number among us faculty. Well, to reproduce myself in the academic world, I needed 1, I don't know, 2, 5, I don't know, pick a number. I didn't need 60. Okay, so where are the jobs? Where are the opportunities for all of our young people? Now, clearly, it's different in China because you're growing your technology so fast. It's just awesome to see the growth. But at some point, is that the only thing? Do all students really want to be involved in research because they do science? Is that the only thing out there? The second thing I see, and this actually is a little bit more bothersome, many graduate programs are simply an extension of undergraduate education. Again, I don't know the situation in China, but I can tell you in the US, an enormous number of programs are out there, and they just say, well, if you just come and take another course in chemistry or genomics or genetics or device or whatever you want, another course taught the same way, taught with essentially the same faculty, you will get a master's degree. Okay? That's not what I see as graduate education. Graduate education should be distinctly different from undergraduate education. They are different beasts. And they're different beasts because of this. This is active learning, the ultimate kind of active learning. What do you do when you learn research? You go into the lab and you do. Now, you have to take courses, you have to have basic stuff, you have to know things, okay? But essentially, the biggest part of your learning as a graduate in a graduate program is doing the stuff, solving the problem, dealing with real world problems, not this. And this, by the way, is growing very, very quickly in the United States, and I can talk about why that is. The point being, it's not good graduate education. So, can we come up with something new? And when I talk about professional science and graduate education, what I mean is we should be able, or at least the goal was, can we educate young people who come with a bachelor's degree in science or engineering, can we educate them to the point where they can, the day after graduation, walk out and begin their careers? Not walk in as me, the CEO, but can they begin their careers? Can they enter a company and be successful as professionals? And so we then talk about, all right, let's set up our own degree, this Masters of Business and Science. So we're very proud of the fact that we invented this new concept. But here's sort of the overall philosophy of how we put it together. First, let's be clear. Students have to enter with a background in science or engineering. You know, and I'm not saying, by the way, and I'm sure you'll agree, if you come with a bachelor's degree in science or engineering, that doesn't make you a scientist or engineer. But you at least have the background. You at least know the music. You at least know enough to know to dig. And you've shown by getting that degree that you have an interest in science and you care about it. And you're the good sort of fertile material to build on. We wanted to build a 2-year program which integrated the science and business and industrial experience. This was very different from how some of the programs, you know, take one here, one here, one here. It's kind of like a menu. You know, you take one from this column, one from that column. That's not what this was intended to be. It was intended to integrate. So when we were to teach them about the drug discovery process, it needed to be in the context of what real companies really had to do. And it should prepare them right away for entering into the life sciences industry. Now, I also want to say this. Now, I believe City University offers an MBA. Yeah, everybody does. So I don't know if I'm offending anybody, but it's not that. And the reason I want to emphasize that, and you know, I get to run away, so nobody can hurt me too badly for saying this. But look, and I have a lot of friends who have MBAs, and we have colleagues who give those. But the emphasis is it's not a generalist teaching. MBAs were designed in the early 1900s to teach young people how to manage large organizations, period. And this isn't that. Not that you can't manage large organizations, but it's focused in the life sciences. So when they do case studies over in your MBA programs, I'm sure, the cases they talk about are McDonald's and Amazon and, I don't know, Kentucky Fried, whatever. You know, they do those. We don't do that. We look at Amgen, we look at Gilead, we look at Pfizer, we look at things with Edwards Life Sciences, device companies. That's what we look at. Those are the kind of things we do. So it's not a generalist degree, and that was built into the philosophy from the beginning. So we invented this new degree. We're very proud of the fact that we came up with a new name, which isn't very surprising, but that was it. So now the question is, what do you need to build it? How do you do that? And when I got there in 2003, we really sat down and spent a lot of time thinking about how to do this. And I want to emphasize something about how we thought about how you had to go about doing it. We needed a diverse faculty team who was willing to experiment and think differently about active and engaged teaching. Okay? And I want to say these aren't the only folks who we started with, but I want to say it's really important if you're going to build a program like this, get people with different perspectives, from different disciplines, from different parts of the country. It doesn't matter. Just get diversity. It's really crucial. And so you know, these are all, you know, some of our colleagues that we started with. And that's the kind of thing we needed. But they were all dedicated to active learning. And when I talk about that, I want to make sure, I mean, again, we all know what that means in the research context. But, and so we made sure we designed a curriculum where lecturing is really, I don't say discouraged, but kind of, okay? We don't encourage lecturing, except for maybe 15 or 20-minute chunks, which need to be followed by doing something with that knowledge. The science of learning is extraordinarily clear that while lecturing may be a good way to teach, and I don't think it is, it's a dreadful way to learn. The problem is that's how we all learned. Everyone sitting here has sat there through lectures, and I know the ones I used to give, and they didn't have computers at the time I used to lecture, but I know now when I give lectures, they're all sitting up there, they're going through their chats and girlfriends and boyfriends and shopping lists or whatever the hell they're doing. And very little of it is actually getting in. So we have to come up with better ways to do it. And if you actually learn for a few minutes, actually about 20 minutes is what most humans can handle, taking in information comes from a faculty, from the lecture, if you will, and then do something with it. Use it, turn around, talk with each other, pick a question that you have to answer between groups of 2 or 3 or 4, and make you use it. It is far more easy to recollect it, to use it, and to put it into another context. So we were really focused on that. And also, they had to be willing to experiment. Not everything works. You got to try stuff, and we were really willing to do that and do it. The other thing I want to mention is soft skill development. We focused on that very hard. And what do I mean by soft skill development? Well, again, I never want to be accused of saying that content's not important. You have to know things. You got to know the science. You've got to know what a device. I mean, you got to know engineering to do. So please, that's not in any way to say we don't need that. But what are the soft skills? We need to teach young people how to be critical thinkers. Ever more important in the world of social media. But students need to be able to take input and find out whether it's right or it's wrong and be questioning enough that it's not hierarchical, that just because I stand up here and say it doesn't make it right. It's just what I said. So they need to be much more critical, and you teach students how to do that. The other thing is creative thinking. How do we teach creativity? And I think you can do that. I think most creativity really comes from putting two ideas together that someone else hadn't put together, right? I mean, there was a guy who put together a bookstore and a delivery service, and gee, that Amazon thing seems to work pretty well. Now I'm making that up. I don't know that he really put that together, but that's the kind of thing that I see as creativity. You can teach that, but the way to teach that the best is the third skill. That's communication. And we teach communication to our students, and I think all too often we focus on showing them how to make a good PowerPoint. Okay, well, okay, that's important, but you could probably teach somebody that in about an hour, and you're done with that one. What really is more important is listening. Listening to other people and finding out what they're really saying. And we can talk about how we do that, but we take it very, very seriously. And that's not just a lesson in science. We could probably all do that, and probably, I don't know if I'm the only one who has a spouse that says I never listen to her, but yeah, and she's right, I know. But I think these are the kind of skills we all need to develop for so much, especially being able to work together and be creative. The last thing is team-based activities. Team-based activities are crucial. There is nothing in this industry that's not done in a team. You have to be able to work in a team, a diverse team, a different team, a team with different kind of expertise coming at you and with you and using that expertise. So those are important things that we want to integrate. The other thing, we wanted faculty who have industry experience. The problem is you can't always get faculty with industry experience, especially in areas like regulatory affairs, of people who know about how these regulations work around the world. And the reason for it is they're doing it in the companies already, and they're making a lot more money than we all do as faculty. And so I don't blame them for not wanting to quit their jobs in industry and come. They like students and they love teaching, whatever. So what we've done is we've been able to start a track where we have people come from industry and they'll teach one course, or they'll do a course online, or we've worked it out so they don't have research obligations, and they are a different kind of faculty, but they still have the stature, they still work with the students, and they still mentor and teach. So we've been able to do that, and it hasn't always worked. The other thing, which is absolutely crucial, is you have to have relations with the companies, and they have to be managed. It's not easy. You can't just invite them to campus once a year, serve them a nice dinner and pretend that's a relationship. That's not a relationship. That's visiting, whatever the heck it's called, but it's not a relationship. You need strong relations, and I'll talk about why that's important. Okay, so he said, well, we wanted a 2-year degree. And I will just pause for a second saying our faculty originally said, well, you can't teach everything we need to teach the students in 2 years. And my answer was, too bad. You got 2 years. There are programs out there that are 1 year, so here's your competition in the real world, because we're not state supported. We have to collect tuition from our students. So 2 years is all you got, and make it work. Make it what we need to do as faculty. I mean, look, it's the same kind of thing. Say, if anybody's from chemistry, I'm from a chemistry background, and Bioscience was the sort of the knowledge of all chemistry. And when I started as a graduate student, Bioscience was about 40 volumes or something like that. I mean, and now it's about 12,000 volumes. So what do? Increase our chemistry degrees 100-fold? I mean, that's silly. What are the essential things we need to teach them? You've got 2 years. Put it together. Put the philosophies together. Put the overall goals together. Let's make it happen in 2 years. And I think we're able to do what we can. So the science is essential. We don't, again, don't want to ever have that come out saying different. They needed to know in the first year what are the basics of these processes that need to be done, and so you know a little bit about all of them. And then what are the business concepts that distinguish life sciences? And one of them is high risk, high cost, all these kind of things in the life sciences. How do you manage that? And then we said we needed a required industry internship. This is required of all of our students, and it must be paid. And that's an important point. Okay, and then the second year, I want to talk about this extensively. The curriculum in the second year is divided up in 2 parts. Half of that curriculum is what we call a team master's project. And I'll talk at some length about what that might be. And then they need to focus in one of the areas. They needed education and they needed experience in one area to give them that depth in one particular area that they could show some expertise. So, what's the first year curriculum? All right, what we did is we have various kinds of science courses and pharmaceutical development that you might get. Biomanufacturing is a huge deal, especially if you include supply chain. And I think all of us lived through the pandemic when the supply chain was really disrupted. There were people who died because they couldn't make some of the drugs that were needed for their care and maintenance. We need to not do that. We need to figure out how to get that to happen and not happen. The diagnostics and devices industry are very, very different from the pharmaceutical industry. They need to know that. And as I say, the regulatory and clinical trials are a huge issue. I just saw today that AbbVie just gave up a $9 billion clinical trial on a schizophrenia drug because they thought it'd work, and it didn't, because they did the final clinical trial. These are huge costs. The biggest cost in making a pharmaceutical is that piece. It's not the basic research. So these are kind of things that the students need to know. And then they have business courses as well. Again, we talked about how you teach that. We can talk about what you do with that entrepreneurship stuff. How do you do it? And by the way, the most difficult or the most interesting question I get all the time is, well, what if you start a company and it fails? And I can't help but look at them and think, well, look, you're 22 years old. What are you worried about? Start another one. You don't have a mortgage. You don't have kids to put through college, whatever. Did you get experience? Was it honest? So anyway, we talk about that. But the other thing that I think is really not involved in so many of these other programs is health economics. And the economics of healthcare are very different in different countries. I mean, we in the States have one of the craziest systems on the planet. But they're certainly complicated around the rest of the world and very, very different. So they need to know these kind of things in different things. Oh, and I would also say accounting is different in China than it is in the United States. We teach courses in India. We have to have Indian faculty teach the accounting because none of our faculty understand how they do it there. So these are really different kinds of things that need to be thought about. Okay, I want to say in the first year, yes, they do courses, but mostly the way they do a lot of their learning is through projects. So they work with startup companies throughout Southern California, mostly, and new ideas. And they do, in the courses, they do business plan competitions. They evaluate various business plan proposals. We do in-house for tech transfer offices at various universities. They get to meet the faculty member who's the founder and work with what we all call founder syndrome, which I can explain later. Learn how to work with those founders, give them all kinds of tips and insight, and do the work that needs to be done in terms of market studies and things like that. We have design competitions. They make prototypes. All of our students, no matter what their interest is, has to make a prototype with a 3D printer for a medical device. And some of them are really quite comical and fun to see. But it's not the point of what they make. It's not going to work. But what did you learn from doing that kind of thing? Okay, so then they do an internship. And I will say, the internship, it's paid between 1 and year 2. It must be paid. We require that, because then it's a meaningful internship. They get work experience, and they get to try out a company. And I will say, it can't be research. It can't be bench research, or it doesn't count. Because they come back and do poster sessions about what they were and things like that. So it has to be in the business part of the thing. Okay, in the second year, I mentioned there's 2 halves to the second year curriculum. One of some more coursework and some more projects, and it's usually focused on one of those 5 areas, you know, management, biomanufacturing, clinical and regulatory, diagnostics and devices, or the pharmaceutical discovery project. Those are the 5 main areas. There's some students who want to do something different, and we will design a curriculum for them as well. But it's all courses and projects to give them that depth. The other part of it is what we call the Team Masters Project. And this is, we're the only institution, we think, in the world that requires a team project sponsored by industry to be done by the students for their graduation. This is year-long, and when I say sponsored, I mean seriously sponsored with money. And there's, right now, this year, I think that costs $75,000. So it's serious money. And we do that for a couple reasons. The first reason is because we like the money, but the second reason is it's got to be a serious project. If it's a free project they just kind of throw out, you don't care about it. You're not invested in it. So how do we know that you're invested in it? Well, get some money. Make it serious. And so it is 50% of the curriculum. It has to combine business and science in some way. We vet the processes and we curate the projects very, very carefully. It can't be research. It's not research-based. It's not lab or bench research. That's not what we do in this program. Okay, so what happens is a team, 3, 5, sometimes 6 students, will work with an industry person, a liaison comes from the industry, their representative, and a faculty member who's an advisor. And they meet with that whole team with the advisor and the liaison meet at least once a week on Zoom. And sometimes the companies have the students come and do the project, or, you know, talk with the workers in the company. And the students are responsible for the whole thing. Timelines, budgets, deliverables. They sign confidentiality agreements. All of those kind of things to make them, they are really working with the companies. And you know, these obviously, I mean, sort of nothing subtle about that, but they listen, you know, the companies get to meet them, they get to know them, and they often lead to jobs. Okay, so who are the regular sponsors? These are the folks that you've all seen kind of everywhere because they are everywhere. They support the projects very often and come back and do it every year. And they do it because they want the projects done as well as they love having the students come work for them when they're done. So let me give you a couple examples because the question comes up, what is it that students can do in a business science context that's not lab-based research, right? Because that's how our heads are all put together as academics, and I put myself in that spot. Okay, supply chain I mentioned before is really important. And Amgen really, during the pandemic, had to stop the production of one of its anti-cancer drugs during the pandemic because the supply chain was so broken, they couldn't get material that they could validate. They could get material. It's an interesting story buried back in there, but they couldn't validate it properly. And they couldn't make the drug for about a year, and patients died. That's a consequence. This isn't pretend stuff. Anyway, so our students didn't solve that problem. What they did is they went back and analyzed their supply chain in great detail and said, where are your vulnerable points? How can we think about putting some backups between them, shortening those supply chains and things like that. Okay, Sigma Tau is an Italian pharmaceutical company. The students were given a project to evaluate 5 potential takeover targets. These are 5 companies that Sigma Tau is considering buying. And the students were to evaluate those companies secretly and go into get as much public information as they could and information about them and their technologies and all that kind of stuff. And then come back and make a recommendation to the company about who to buy. And the students did that project, and they did it so well that they all got to go to Rome, meet with the leadership of the company, make their recommendation, and the company actually bought the company they recommended. I mean, it was just really interesting. It was a great project. The only bad part was I didn't get to go. So other than that, it was a good project. If Analytic Jena is a device company, it's a research device company, not a medical device company. Some of you may know them as UV products back in some of the old days. I don't know if people are old enough to buy their stuff. But anyway, our students designed an automatic imaging system that could actually, so when mice have green proteins coming out of them in different places for different treatments, they run around because they're mice. They developed a system that could actually follow them around in the cage and do quantitative measurements. That system is now for sale all over the world by Analytic Jena. Our students did it. This is a big deal. Minorities populations typically don't participate in clinical trials, and that has consequences. Part of the consequences are especially for a lot of drugs, companies can't find enough patients to do trials. That's a major holdup for getting approvals for lots of different drugs. And so here we have all these minority populations that, for lots of reasons, one of them is they don't trust the system, so don't do an experiment on me and my family. They have that, and you know, with some reason, there's something behind it. There's that, so the companies can't get enough patients. And secondly, remember, when someone is being given a treatment, the control group gets medical care at the highest level to compare it. Okay? So what happens is in these minority communities, by not participating, whether you're in the control or in the experimental group, the test group, your healthcare backup goes up. But it's really hard to do and make that kind of thing happen. And that was a really quite successful project that helped Pfizer think about how to get into minority populations better. And I will have to say that I am extraordinarily biased. That project was the best one, and it was the best one because my daughter was part of that one. So we can cheat. Okay, Thermo Fisher, a scientific supply house that many of you know. You buy things from them all the time. Near the end of the pandemic, they wanted to know, with all these new nucleic acid drugs, the mRNA vaccines, mRNA treatments for different kinds of immunological disorders and things like that, those kind of nucleic acids, what were they going to need to do in terms of supplying the reagents for research? In other words, what kind of things were going to need? What kind of kits were they going to be able to put together? And so they did a very extensive study, and Thermo Fisher is using a lot of their recommendations for how to prepare for people buying more supplies. Eli Lilly was really interested in, you know, where's the future of regulatory affairs, especially with changing political climates. And I don't need to go into great detail, but geopolitical climates change very quickly. How is that going to affect regulatory affairs in different countries? And they actually focused on a couple of international programs and how those regulatory regimens were going to change. And Hologic is a women's health organization. They were very interested in point-of-care diagnostics and what the market for those was and what the issues were. Now, what point-of-care means is, I know in China, if you get sick, you go to the hospital. Am I right? You don't go to a doctor's office, or do you? I don't know. Do you? Or you do, I don't know, whatever. Anyway, certainly in the States, if I don't feel good, I'll go to some really tiny clinic or something. And they can either do the test there, or I can do the test at home, whatever it might be, or they can send it out to some central laboratory and come back with the results. The question is, what do those various markets look like? Do people really want to do the test at home? Can they handle the data? Can they do a test that's simple enough that they won't mess it up? Right? Most consumers don't know how to do a whatever. They can manipulate anything. So you know, what is the future, and what are the challenges, and what are the ethical considerations? I mean, what happens if you do a test at home and find out if it tells you, yeah, I have cancer? Well, it could be wrong, but I could have consequences from that I'm going to go out and commit suicide. I mean, those are extreme, and I'm being weird, but you know, that's not out of the question. So these are really interesting and complicated questions. And especially Hologic wanted to know answers to those and insight into those, especially in the women's health arena. Okay, and then Amgen, as you can imagine, we have a lot of relations with Amgen, but one of the projects was they have a lot of biosimilars. They have a lot of proteins that are coming off of patent protection. And the question is, how do they line them up? What are the competitors doing? Which are the ones they should be focusing on and still selling at a lower price? So again, I just want to give you some examples, and then you know of what the kind of program is like. It's a different kind of program, as you can see, and we were very excited about how it is. But does it work? Does the program succeed? And what's the measure of success? Well, I think it's what happens with our students. 95% of the graduates are employed within 6 months of graduation. That statistic is held now for, over the last decade. Very, very high employment rate. We can talk about the fine points of it. We have 1,300 MBS alumni. We've come a ways from our 20 alumni when I came there, but we're growing, and there are companies that have many, many KGI graduates. And in fact, I can tell you that there's a competitive analysis group at Amgen that, as far as I can tell now, only has KGI graduates. Okay, we've also had some companies founded by our graduates, and I'm actually surprised. This number is actually, to me, it's surprisingly large, because we tell our students a lot about, they come and ask, so should I work for a large company or a startup company? And my answer is always, pick one. It doesn't matter. You don't know the answer. Just work with good people, right? Find people you can learn from and work with, and it'll happen. Things will happen. You'll get experience. You don't know how to plan that. Don't over-plan. It's not going to work. You have to look at opportunities, but get experience with good people. And since our alumni are mostly pretty young, because we've been growing over time, and most of our alumni are sort of about 40 years old. It's pretty young to start companies. So we'll have to see how those companies go and which ones are successful and which not. I can't tell you that yet. But that's the number for up to last year. That's their starting salary, is about $95,000. It's an impressive number. And by the way, some areas are higher than others, so there's some averaging going on there, which I'm not embarrassed to do. And I can tell you that regulatory affairs and manufacturing pay the most. The needs in regulatory affairs are just insatiable, and there's huge opportunities in that one. Then the question is, are they doing well in the companies? Okay, are they progressing? Are they moving up? That 250,000, we questioned that when we first started collecting that data, but it's real. That's a serious challenge. In fact, my daughter that I talked about in that program is in regulatory affairs. She's been out 6 years, and I know what she makes, and I want all that tuition money that I paid her back. Okay, I know what she's making. No, but most important, I mean, yeah, these are great. These are really impressive numbers, I have to tell you. But mostly, they love their careers. They really love what they're doing. They're doing something meaningful. They're doing something exciting. They're invested in it educationally and emotionally, and it's really working well. So where do they go work with? There's 3 buckets of kind of employers of the graduates, and these are the big companies that you'd guess, right? Gilead, Amgen. Those are the big company kind of representatives is a significant number. The second group are the startups, and we were actually getting surprised at that number. I don't know if it's big or small, but we hadn't expected that many because our students don't come out with experience. They come up with kind of experience, but not much. So we'll have to see how that's. This is where they started, by the way. They're not necessarily there. And then the third group we really didn't predict. It was a whole new thing, and that's consultancies. And as we went back and talked about it, it makes sense now. And one of the founders of Amgen, which obviously hires a lot of our alums, said, he sort of considers our students like stem cells. They can go lots of different places and do stuff and be useful. They're not going to go in as a CEO, but they can fill a lot of needs in companies and move around and know enough. And I think, yeah, that's kind of cool. So just some quick things. So what do they do when they're in the companies? Okay, just quickly. I don't want to go into this in detail. Neha's in charge of a group that's looking at strategies to see what her competitors are doing. As soon as Amgen comes out with another product, what do the other companies do? How do they maneuver each other? So how to try to stay ahead of the competition. Mike is in charge of transparency of clinical data at Gilead, especially for the antivirals. Because the question is, when you have all that data coming out about treating viral diseases, especially diseases that are so prevalent in Africa, and the underdeveloped South. The question is how much data, what good data should come out to help those countries move forward. Gabriella is involved in a biomanufacturing company. Again, she is continually coming to campus saying, we need more. We can't find enough people to do the manufacturing because this supply and wanting, and this is an interesting thing to deal with here in China, wanting the domestication of production. Okay, where should it be produced and how should it be produced? Really interesting set of questions. Aaliyah is at Google's new healthcare startup working on strategy and working on how Google is going to do healthcare, compete in the healthcare world. I have no idea what they're ultimately going to do, but they really are making inroads in healthcare. Luis is a regulatory affairs associate at Edwards Life Sciences. That's a company that makes heart implants and heart valves, and looking at their new, and he's actually working on a new, what's called transcatheter heart valve, working on how that's going to get approved and regulated around the United States. Kevin is at Bain & Company. It's a private capital, private equity company that buys other companies and does whatever they do. Ashley is in regulatory affairs at Gilead as well, heavily involved as well in the antiviral group at Gilead. And Mohammed is in supply chain at Amgen, working on the clinical supply chain mostly, because you have to, if you're going to treat 1,000 patients, you have to be able to have a supply chain that is almost identical to the one when you're going to start to treat 1 million patients. So it's really a complicated dance to get that one right. Anyway, just now, I just want to say, I had said at the beginning, there is a correlation. It's not, the purpose of this program is not necessarily to transfer technology. They're kind of hooked together in your head, but they can help, and they can be part of that, part of the process. And the reason they are is we partner with lots of different, our neighbors in California. They all have technology transfer offices, just like all the universities do here. And they all have very early stage technology, and the students work with them on those things. We also have, we have an in-house small incubator. It's very tiny, but we work with the other incubators in the region, Pasadena and LA area and things like that. And they work with the companies, and what do? They help the companies focus. They help the companies look at their goals. What is it you really want to make, and what do you want to do? Then what is the actual need you're fulfilling? Right? That's really sometimes a question. Well, people have a disease. Yeah, okay, well, okay, tell me more. Is there another way to treat it? Are there other ways to alleviate it? Are there less expensive ways? And what are the consequences of it? The other thing, the analysis of markets, and this I want to just pause for a moment. If you're in the ag world and you're making a new food in the United States, you have 4 customers. That's it. You have 4 companies that will buy your seed and distribute it. That's it. That's very different than saying, well, I'm going to make a food and I'm going to go sell it on the street. That's not the market. That's not the market at all. Same thing, by the way, with medical devices. Okay? In the United States, you have 6 companies that sell virtually all medical devices because hospitals buy them in big chunks. They don't want to have to go and get, Band-Aids here and scalpels there. They don't want to do that. It's too much work. So what happens is these guys bundle. So you have 6 companies in the United States that are your sales. So if you want to make a medical device, great. I mean, we certainly need more of them. You have 6 customers. Do you understand that market? So there are really different kinds of things that need to be done. And then the other thing, I haven't mentioned it before, is intellectual property. Ownership of the technologies is sometimes a really complicated issue. You can get around it or not get around it, or it can kill you. And then sort of the realism. What are real times and real costs? And we do a lot of exercises with the students where we make them come up with a number really quickly, just at the top of their head. How much do you think it's going to cost to take that technology we just tested, we just presented to you, which is maybe silly or not? How much money do you think it's going to take? And I can tell you, any number you come up with, multiply it times 10, and you'll be closer. Okay, so these are really, really important kinds of discussions to have. Okay, I just really want to, I'll go quickly. What did I learn from all this? Well, or what did we learn from all of this? Number one, active learning, I think, is really effective and really does work. Using that knowledge, putting it together, the students like it. We think from all of our testing and from what we see in the market, it works well. Team-based activity is crucial. Students need to know how to work with each other. You can do some stuff online, but some stuff online is better than not, but it's not the same as being in a room and working with each other. Soft skill development is crucial to the point where we have mock interview programs, so we teach them how to interview for jobs, how to write their resumes and do all those kind of things, how to dress, how to do all those kind of things. It's hard to get faculty in some areas, so I mentioned the professor of practice approach to get people who can teach certain expertise. And the broad industry relations are absolutely crucial. You can't do this right. You can do it, but you can't do it right, I think, in being responsive to the industry unless you know really what they want and spend time with them and learn from them. And then you can do some things online. We have a program in India that we do, which is it's all online, but it's a lot of active learning. And the hardest part of some of those kind of programs is trying to get the students so that they will argue with you and disagree with you. But once you get to that, it's really kind of wonderful. Then they never believe anything you say again. Anyway, then sort of what are the opportunities? And I just want to put those out here real quickly at the end of my time and say I think more of these programs need to be built. We desperately need more of the science coming to benefit society, and I think this is one of the limitations. Our experience is out there. I love talking about it, as you can tell, because even though I told you how bad lectures were, I just lectured at you for an hour. And I think there's a lot in this model that can be replicated. Not everything is universal. A lot of things are different in different cultures, but I want to just talk about that. So let me just say, by saying I look forward to saying, how do we work together? What can we do? You are all colleagues, friends, and Anderson, thank you for helping initiate this, and thank you for having me, and it's been a real joy, and I look forward to chatting some more. Thank you.
Yeah, thank you, Professor Schuster, for such an enlightening lecture. So as a small token of our appreciation, I present you this souvenir with our CityU Hong Kong logo.
Oh, thank you very much. Thank you so much. Thank you.
Thank you.
Thank you very much. Thank you. Okay.
So, Anderson, do you want to close the lecture?
Okay, so before we close, maybe we have any questions from the audience?
Yeah.
Yes, please.
I think it's a great talk, so I don't know how it's a 1-hour lecture. So I just one of the question I have is you mentioned where the students go after graduation, but you mentioned where those students come from.
Good question, sir. Thank you. We have. It's about for all those years, it's been about 80% domestic students, U.S. students, and the rest are international. For many years, we had a significant number from China. Now, given how hard it is to get a visa to come to the United States, which is absurd, but we can talk about that at another time, most of our international students come from India. But we're open to everyone. Since we don't get state money, we're open to any student from anywhere who meets the qualifications and has the language. I'm sorry, thank you. The background, almost about 75% were a biology background. Okay, biology or biochemistry. See, one of the things that I think it's so frustrating to me in the United States, 85% of all undergraduates in the United States who declare science or engineering are pre-med. They want to be doctors, okay? I can have all kinds of discussions about why that's silly, but don't worry about it. So a huge number of them come because they have that right background. They've taken the biochemistry and they've taken the chemistry, but they didn't get into medical school. So for a whole lot of them, I have to tell you, it's their second choice. It really, really is. I hate to say that because I can promise you, well, first off, I mean, one of my daughters is a doctor, and it's not that great a wonderful thing. But they're not going to get into medical school, and they don't know what it's about, and they don't know why they're really going to medical school. But the other side of it is there is not a single undergraduate on earth, I don't think, who comes into college and says, I want to be a professional in regulatory sciences. Not a one. They just don't know about it. So I think if we, again, the big we academically, do a better job informing young people about what the opportunities are, I think we'll be able to change that. But they all need, so we just open it up. Anybody with any science degree, chemistry, biology, plant sciences, botany, or even who has taken a bunch of the courses, and mathematics, by the way, as well, since so much of the science is computational, and engineering for sure. Engineering students do really well in bioprocessing and biomanufacturing. So yeah, but most of them are biology. Most of them are, I don't want to say this, they all, if you dug into them, they were all pre-med. just saying, but, okay.
Yes, please,
Yes, sir.
Professor He.
Yeah.
Yes.
I'm from basic science and try to get into the drug development field. But what I see is the success rate for clinical trial is something single digit or percentage. So what was the main cause of the failure? And how do you see the future if we understand the target better? Could that success rate being increased?
Yeah, look, I mean, you're right. Most clinical trials fail, right? I think about, so, you have three phases of clinical trials. Phase 1 is just for safety. Phase 2 for sort of a difference between a little bit of dose escalation and seeing if you get consequences. And the third phase is, whether it really works on a large population. I think a lot of them will get better because of the genetic screening. So you've got two things going on. We're going to do more and better genetic screening for patient groups, and that's going to have the consequence of making those more successful, but it's going to make them successful in a smaller group. So you've got this two-edged thing going on here that they're going to succeed. They're going to work in the group that have this right genetic profile, but that's a smaller group. And what you're seeing with that, so in the United States, we have the Orphan Products Act, which means if you work on a disease with less than 200,000 patients in the United States, or incidences every year, you get special protection and you could do clinical trials differently. So what they're seeing is as they learn more about genetics, they're refining and refining till they get to the point where essentially every disease can be rare if you know it. And not diabetes, probably not, but almost every cancer you can squeeze down if you get enough genetic information to being a small group. So I think that's going to increase the rate of clinical trial success. And from that, once you do that, what we're saying all the time is now you have the money and you can go test it on some other subgroups and other kinds of things. So those kind of things I think are going to get better. The other thing is, one of the reasons clinical trials don't even get started is because too many of the companies don't have what are called surrogate endpoints. So for example, for statins, the drugs that lower cholesterol, when they got them approved, there was no evidence whatsoever that it dropped heart disease. It didn't do that. I mean, they had no evidence for it. But they were able to get what's called a surrogate endpoint, lowering cholesterol. So they were able to convince the agencies that if you lowered cholesterol, okay, that's good enough. Now then they did the trials later, and they do in fact, right? And I was involved in a company that for example, I know the technology works to prevent kidney stones, okay? If anybody's had a kidney stone, you don't want a kidney stone. It's really bad in males, okay? So we can prevent it. The problem was we were never smart enough to go to the FDA and get a surrogate endpoint approved. And the surrogate endpoint should have been lowering oxalate concentrations in the blood. So if you think about how to do a clinical trial, so how many thousand people do you have to have who might get kidney stones in the next 10 years? It's a massive trial. Can't be done. So the company failed, right? So I think there's going to be evidence like this. And then just the last thing, I'm sorry to go on about this. They're also doing clinical trials differently now so that you can watch a couple patients, see what they do, and then pivot and move and keep doing that. And I think that's going to increase the success rate in some areas. So I apologize for that long-winded answer, but I think there's a lot of, it's getting better.
So thanks a lot, Professor Schuster. I'm sure there are lots of more questions. So fortunately, Professor Schuster just told us that he could stay for longer at CityU. So if you have time, if you're interested, please let us know. We'll arrange some time for you to interact with Professor Schuster for longer. With that, I think please join me to thank Professor Schuster once again for a very fascinating talk.
Thank you so much.